Good morning, everybody. Today we're going to be teeth. We're going to be comparing primary teeth, anteriors, posteriors to each other. We're going to be comparing them a lot with permanent teeth. Which primary teeth look like permanent teeth? Which primary teeth are unique, that they don't look like any other tooth? Be focusing a lot on the eruption sequences, the ages of when the teeth start erupting, whether they're primary or permanent. We're going to be comparing a lot. So yeah, let's start with our first slide. Okay, so for the first two slides, I put up the eruption sequences. It's very important for you guys to know, just because when you get a question in the future, whether it's from a patient's parent or whether it's on your dental boards, they're going to be giving you scenarios that are realistic. Let's say, for example, like a patient's mom would call you and tell you that her baby's first tooth erupted, and the baby's, kind of in discomfort. What should she do? You can automatically guess, okay, this baby's first tooth erupted, so they're going to be lower central incisors, and the baby's 6 months old. You understand what I'm saying? So this is why it's important for you to know when the teeth erupt, whether it's primary or permanent. This is the first one. So you have all the teeth and the time of toothing and when the primary teeth come out and then when they fall. Okay. And then the next slide, I put in the eruption sequences of when the permanent teeth start erupting. Okay. So this is very important for you to know. Try to go over it several times for you to exactly remember. Try to do like a sequence chart or whatever works for you, but it's really important for you guys to know. Okay. So let's talk about the first tooth to erupt. We all know in any primary dentition, the first tooth to erupt is the mandibular central incisors. I put in this little image over here. I mean, if anybody experienced living with a baby brother, a niece, a nephew, you would always see that the lower central incisors are the first teeth to erupt, followed by the upper central incisors, and so on and so forth. Okay? So this tooth usually erupts 6.5 months of age, 6 to 6.5 months. Now remember, usually girls have their teeth erupt faster than boys. That's an important point to remember. Girls are always faster growers than boys. Girl power, yeah. And also remember that the weight of the child also plays a role in when the teeth erupt. So the more slender or skinnier the child is, the faster the teeth are to erupt, versus when the child is a little bit chubbier and a little bit more healthier, the teeth will erupt a little later stage. Just keep monitoring it. Even if the baby has their teeth erupting a little bit later, just keep an eye on it to see what's going on, what age is he at, what factors are playing a role in the eruption. Okay, this is all factors that you need to keep in mind. Okay, as for the root of the tooth, so when it erupts, only the crown is erupting, right? Not necessarily that the root is fully completed. So the root is fully formed and calcified by 18 months of age. So that's a 1.5 years. So that's an additional year after the tooth starts erupting. It starts forming and calcifying. This tooth is bilaterally symmetrical when viewed from facial and incisal. Okay, it's the smallest tooth, guys. Remember, there's not going to be like major differences in the dimensions of the tooth. It's just a tiny tooth. It's going to be symmetrical, kind of like the permanent central incisor. Okay, notes to remember. So the first permanent tooth to erupt is the mandibular first molar, which is the cornerstone of the mouth, remember? And that happens at 6 years old. Oh, I'm sorry. I should have put an S. It's okay. At 6 years old. It's shortly followed by the maxillary first molars. Now remember, at the age of 6 months, the lower central incisors erupt, and then followed by the maxillary central incisors, right? The first permanent tooth, just remember number 6, is going to be the mandibular molar, first molar, followed by the maxillary. So the mandibular teeth are usually more likely to erupt before the maxillary. Just keep that in mind with the eruption, when remembering the eruption sequence. It's just easier to remember. The first permanent tooth to begin calcifying is the mandibular first molar. It happens at birth. Well, that makes sense, right? Because it's going to be the first tooth to erupt, so basically it's going to be the first tooth to begin calcifying. The first succedaneous tooth to erupt is the mandibular central incisor. Now remember, succedaneous, that means that tooth erupts because there's a primary tooth and then it's followed by a permanent tooth. So, for example, let's say the permanent molars, any molar, first, second, or third, they're non-succedaneous teeth because there's no primary teeth following it before, right? Okay, so the first succedaneous tooth to erupt is the mandibular central incisor at 6 to 7 years old. Remember that the mandibular and maxillary first molars are not succedaneous teeth. So, when you get a question or when you get asked, what's the first non-succedaneous to erupt? Mandibular first molar. What's the first succedaneous tooth to erupt? Mandibular central incisor. Just keep that in mind. But just to let you guys know, the mandibular first molar comes before the mandibular central incisor. I don't think they're that far apart when erupting, but the mandibular first molar is definitely the first. The permanent maxillary central incisors erupt at approximately 7 to 8 years of age. Okay, so it's followed by the mandibular centrals. Pretty much common sense. The permanent maxillary lateral incisors erupt at approximately 8 to 9 years of age, right? Okay. So let's talk about the primary central incisors. Here I put a nice picture to illustrate the difference between the primary teeth and the permanent teeth that are erupting over here. You can see a huge difference in the shape of the tooth, right? I mean, it's pretty obvious. So let's read. The primary central and lateral incisors are very similar to permanent incisors. Okay, very nice, but differ in one important trait. The newly erupted primary incisors do not show mamelons. Okay, so this is where the picture comes and plays a role. So you can see the upper centrals are flat, they're wide, they're short, they're like little chiclets basically, right? And you can see over here, the lower central incisors have mamelons, and those are the permanent ones. You can tell right away they're bigger in size, they have mamelons, they have more anatomical features than the primary teeth. So that's one huge difference that you need to keep in mind. That's one way to differentiate between primary and permanent teeth, especially like when you can't tell the difference because the sizes are small or that person has small teeth in general. This is a good way to differentiate between them. Primary maxillary incisor crowns are wider mesiodistally than their crown height. Well, obviously, you can see it from the picture over here. As long as you remember the picture, you're going to remember all this information. Just always relate your information to a picture and try to apply it, or just look at, your baby sister, baby brother's teeth, and it'll be easier for you to remember. So the primary maxillary centrals are wider mesiodistally and they're short, okay, occlusocervically. The incisal edge of primary central incisors is straighter than the permanent central incisors. Yep, because the mamelons play a factor, right? Labial and cervical ridges are prominent on all primary central and lateral incisors. Alrighty. Now let's talk about the canines. Now remember, when you talk about canines, especially when it comes to the primary dentition, I want you to remember one thing: vampire teeth. Every kid will tell you, oh, I have vampire teeth, because their canines are so sharp, right? And so it's anatomically different in shape than when you compare it to the permanent canines. We're going to discuss all of this right now. I just want you to remember, primary canine, vampire. I assure you. Okay? So that's how you remember that the canine is much longer and sharper in the primary, because it's a vampire tooth, remember? The mesial cusp ridge on the primary maxillary canine is much longer than the distal cusp ridge. Now remember, if you remember the lecture of the permanent canines, this was vice versa. The mesial cusp ridge was way shorter than the distal cusp ridge, but that's not the case in the primary canines. It's the opposite for all other canines, including permanent. So it's the opposite even for mandibular canines. Only maxillary primary canines, their mesial cusp ridge is longer than the distal cusp ridge, while the primary mandibular canines and the permanent canines, all of them have a shorter mesial cusp ridge. Okay. Primary maxillary canine is wide and short. These are the pictures of the primary canines. This is the central, lateral, and the canine, and this is the permanent canine. You can see the difference. Okay, so this is the mesial cusp ridge over here on the primary maxillary canine, and you can see that it is longer than the distal, while in the mandibular, it's shorter than the distal, and it's the same with the permanent canine. It's shorter than the distal. Okay, so it's good to relate this information to the pictures again. All canines, primary and permanent, have 4 lobes. Remember, all teeth have a minimum of 4 lobes. You can't have a tooth without having 4 lobes. 3 on the facial and 1 on the lingual. Makes sense. Primary canine's cusp tip is located on the mid-facial central facial lobe. It's on the central facial lobe. Okay? So you can see right here. It's not really affected by the cusp ridge, the mesial or distal, like the permanent canines would be. Okay, maxillary first molars. The characteristics of the primary maxillary first molar. Here's a nice picture. We have a full view and an occlusal view. So it is the smallest molar in all dimensions, except labiolingually. Okay, so it's the smallest molar in all dimensions mesiodistally, but not labiolingually or buccolingually. While the primary mandibular molar is smaller than the primary maxillary labiolingually. So, not to get you confused, the maxillary first molar is the smallest molar tooth. It's smaller than the mandibular first molar, okay, but the only difference is that the mandibular first molar, the primary, is smaller labiolingually than the maxillary first molar. But that doesn't mean that the maxillary first molar is not smaller than it, okay? So just keep that in mind. There's just like a mini exception. It's important for you to keep that in mind, just in case you get asked about it. The distolingual cusp is poorly defined. Isn't it always though? Usually the buccal cusps, the mesial cusps, they're the ones more prominent. They're the ones that are longer, that are bigger. And the distolingual is poorly defined, probably doesn't exist. Small rounded when it exists. Okay. The cervical line is higher mesially than distally. Okay. Kind of like if you remember the permanent central incisors, we had that same scenario. The cervical ridge stands out distinctively on the mesiobuccal portion of the tooth. This is also another thing important to remember. So when you're restoring the tooth, when whatever you're doing to the tooth, you need to keep that in mind, okay? Occlusal pit groove pattern is most frequently H-shaped. This is most frequently, I'm sorry, that's a typo. It's H-shaped, okay? So you can see it over here in the picture. It's an H. 3 roots, slender and long, spread widely, and have a small root trunk. Root trunk is usually from where the crown and the root communicate until the forcation area. So you can see in permanent teeth, it's usually longer, but in primary teeth, it's usually very short or non-existent. And the roots flare out, they're long, they're thin, but it's kind of the same concept of the permanent maxillary first molars. On the crown, mesial surface is larger than the distal surface. That's another thing to remember too. So the mesial part of the crown is way bigger than the distal part of the crown. Okay? Alright. Maxillary second molar. It resembles a permanent maxillary first molar. Nice! So if you guys remember anything about the maxillary first molar, the permanent one, it has an oblique ridge, it has a fifth cusp of Carapelli, all that good stuff. So the maxillary second molar resembles the permanent maxillary first molar. The primary maxillary first molar, we didn't say that it resembles anything, but you just got to remember those points. That it's the smallest primary molar, that it has an H-shaped occlusal pattern, all that good stuff. Okay, the primary maxillary second molar is generally smaller than the primary maxillary first molar. Okay. It is wider facialingually than mesiodistally. Yes, we said that before. May have a fifth cusp of Carapelli, yup, because it resembles the permanent first molar. It has a prominent mesiobuccal cervical ridge, okay. It has an oblique ridge, just like the first molar. Largest to smallest cusp is mesiolingual, mesiobuccal, distobuccal, distolingual. Distolingual is always the last one, okay, just keep that in mind. So the first largest cusp on the maxillary second molar is going to be mesiolingual, followed by mesiobuccal, distobuccal, distolingual. The largest and longest pulp horn is the mesiobuccal. So you just got to keep that in mind when doing restorative treatment on that tooth, not to have pulp exposure. Okay, now let's go to the mandibular first molar. Mandibular first molar has an occlusal surface shape is oval. Okay, it's wider mesiodistally and buccolingually, so it's bigger in all dimensions. It has 4 cusps, while primary mandibular second molars have 5 cusps. So I think it is safe to assume that the primary second molars, whether it's maxillary or mandibular, they're going to resemble the permanent molars in terms of the oblique ridge, in terms of the how many cusps they have, everything. Okay. So in this case, cusps largest to small, mesiobuccal, mesiolingual, distobuccal, distolingual. Don't get confused over here, okay? So just look at the occlusal pattern or the occlusal view of the tooth and just remember these many important points. Buccal surface is much longer than the lingual surface, okay? It also has a very prominent cervical ridge across the gingival area. It has 2 roots, mesial and distal. The mesial is longer and wider. Okay. Occlusally, the mesiobuccal angle is acute and prominent due to the mesial cervical ridge on the buccal surface. Primary first and second molars show calcification at 5 to 6 months in utero. So even before the baby is born, while it's still in its mama's belly, it's starting to calcify. And as soon as those teeth erupt, as soon as the baby's born, the permanent molars start calcifying. Remember that. In general, the root of a deciduous tooth is completely formed in just 1 year after eruption of that tooth in the mouth. That's an important piece of. That's going to make it easier for you to exactly when the roots are completely formed, because if you remember teeth, remember when the tooth is going to be completely formed and calcified. Okay. Continuing with the ridge separating the mesial portion from the remainder of the occlusal surface. Cool. It does not resemble any other primary or permanent tooth, so it's unique. It's the first molar. Remember what we said about those? They're unique. The mesiobuccal cusp is always the longest and the largest. That's in the mandibular, while in the maxillary, it's going to be the mesiolingual. The crown is wider mesiodistally than high cervical occlusally. Okay, it's kind of the same with the primary maxillary central incisors, where they're wider mesiodistally than taller, so they're short teeth. The mesial marginal ridge is well developed and resembles a cusp. It has a prominent mesiobuccal cervical ridge. Class 2 cavity preparations are difficult due to the morphology and high mesial pulp horn. Remember, the mesiobuccal in the mandibular first molar and the mesiolingual in, was it the mesiolingual? Let's go back and see. In the maxillary. Mesiobuccal. It's the same. It's going to be high. Okay? So you just have to keep that in mind. And it has no central fossa. It's unique. Okay, now between the maxillary, primary, and permanent second molars. Let's just talk about the second molars. Enamel cap of primary molars is thinner and has more consistent depth. Okay. Greater thickness of dentin over pulpal wall of primary molars. The pulpal horns are higher and especially mesial horns, and pulp chambers are larger. Okay, that's another thing good to know, that the pulp chambers are larger. Cervical ridges are more pronounced, especially on buccal aspect of primary first molars. The enamel rods at the cervix slope occlusally instead of gingivally, as in permanent teeth. This is an important point to remember, okay? I need you to remember the orientation of the enamel rods between primary and permanent. So now we know in primary they slope occlusally, when in permanent they slope gingivally. Primary molars have a constricted neck compared to permanent molars. Yeah, permanent molars have like a wider neck, they're bigger, they're stronger, while primary molars are so petite and small and they're like a little bit constricted and narrow, like they have a waist, you know what I mean? The roots of primary teeth are longer and more slender compared to permanent teeth. We've seen that in the pictures. And they don't have The root trunk, remember, it's either small or non-existent. The roots of primary teeth flare out near the cervix, then do those of permanent teeth. Yeah, they flare out. Permanent teeth tend to be closer to each other. Differences between primary and permanent molars. Yeah, let's discuss that. Primary molars have crowns that are shorter and more bulbous. Well, remember, they're tiny, tiny teeth, with pronounced buccal and lingual ridges and a constricted cervical area. Yep, very true. Primary molars have an occlusal table that is narrower facial-lingually. Yeah, that was the case in most molars that we just overviewed right now. Primary molars have anatomy that is shallow. Very true. They, remember, to remember at this point, okay, I'll give you an example. When you have a child that's 7 or 8 years old, they have all their permanent first molars out by now, right? Those permanent first molars will have cavities than any primary tooth. Just remember, the anatomy of a permanent tooth is much more steeper and deeper than the primary tooth. That's why they always do on permanent teeth than on primary teeth, because they're more susceptible to getting caries. Okay. Primary molars have a prominent mesial cervical ridge. Yep, easier to distinguish rights from left, absolutely. Primary molar roots are longer and more slender than permanent roots. The roots are extremely narrow mesodistally and very broad buccolingually. Primary molars have roots that are very divergent and less curved. There is little or no root trunk. Yep. Okay, so now let's move on to the mandibular second molar. Now, this is an important point to know. The permanent mandibular first molar has a morphology that closely resembles the primary mandibular second molar. There we go. So now we know that this resembles the primary maxillary second molar resembled the permanent. No, let me do that over. Yes, the primary maxillary second molar resembled the permanent maxillary first molar, and now the permanent mandibular first molar resembles the primary mandibular second molar. Okay. From the buccal aspect, the primary mandibular second molar has a narrow mesodistal calibration at the cervical portion of the crown. Okay, so mesodistally, it's constricted. The mandibular permanent first molar, accordingly, is wider at the cervical portion. That's the only difference. Groove patterns are different on the occlusal surface, as you can see over here. The primary tooth has more divergent roots to allow the eruption of the permanent second premolar. That's why the primary teeth have wider and more slender roots. It's easier for them to be resorbed when the permanent tooth comes popping out, and poof, it pushes the primary tooth out. Okay. Primary second molars have the greatest facial of primary because morphologic deviations from permanent teeth are the first molars. Okay. Primary teeth. On average, primary teeth take 10 months for completion of calcification. Yeah, we said between 10 months to a year, right? The primary teeth begin to form in utero to about 6 weeks. Hard tissue formation is in the 17th week in utero. The permanent teeth begin to develop at approximately 4 months of age in utero. Yep. And at birth, they start calcifying. Maxillary and mandibular first molars begin to calcify at birth. They are the first to begin calcification. Why? Because they're the first to erupt. The mandibular third molars are generally the last teeth to begin calcifying. This happens at about 8 to 10 years of age. So that's why the eruption of the third molars is usually at a later stage in life, when you're between 18 to 25. That's when your third molars begin to erupt, because they calcify so late, so it makes sense. Now, I put in a little chart for you, another reminder of the eruption, crown completion, first evidence of calcification, all that good stuff. So just go over this table, and it shouldn't be too confusing, because here we've learned the numbering systems, remember? And the universal one states that A, B, C, D, E, F, G, H, I, J, those are the teeth, the primary teeth, right? Those are the upper and those are the lower. So just remember that. Go by that. It's going to be easier for you, and these numbers represent weeks, these numbers represent months, and those represent years. It's all on the table, okay? So just take a look at it. Okay, so to cap it up, the largest primary tooth is the mandibular second molar. The smallest primary tooth is the mandibular central incisor. Makes sense, right? So like remember in the mandibular arch, it kind of resembles the permanent teeth when we discussed how the central incisors are the smallest, and the more posterior you go, the bigger the teeth get. So this is exactly the same scenario. The largest permanent tooth is the maxillary first molar. The smallest permanent tooth is the mandibular central incisor. Okay. This is another reminder of the eruption sequences. It's color-coded. I mean, I put so many different charts in to see maybe the color-coded one is going to be better, easier for you to remember. Whatever works for you guys. Okay, now we're done talking about anatomical features. We're going to start talking about a little bit about the occlusion and what's happening in the primary dentition. So there's something in the primary dentition that's called primate spaces. Now, I don't know if you've already guessed it or not by the pictures here, but it's exactly what you're thinking. There's spaces between the teeth, but it's only between primary teeth. It's not applicable to permanent teeth. Okay, now we're going to know why they exist. In the deciduous dentition, spaces appear between maxillary lateral incisors and maxillary canine, right here. Maxillary lateral, and this is a maxillary canine, and you have a big space over here. And then on the mandibular canine, mandibular first molar, there's a space over here. Now, these spaces are supposed to be the widest spaces, or if the child doesn't have any spaces, at least they're going to be there. But in this case, it's an overall spacing, which is pretty normal. Spacing is normal throughout the entire dentition, but most noticeable in the locations mentioned above, right? These spaces, now why are they there? These spaces are present from the time the teeth erupt, as it is a requirement for proper alignment of the permanent incisors. The spacing is frequently caused by the growth of the dental arches. Okay, makes sense. So we know that a child from age, let's say, from age 2 to 6, their jaws are like rapidly growing, rapid growth spurt. The jaws are increasing in size. So the teeth are not going to increase in size. I mean, they're going to stay the same size. So you're going to have these spaces between the teeth. Now, these spaces between the teeth, the primate spaces, are very, very helpful when the permanent teeth start erupting. Why? Because we all know that the primary teeth are smaller in size than the permanent teeth. So when the permanent teeth come out and take place, there's extra space for the larger teeth to come in, right? So at that point, alignment should happen naturally, but some jaws are different. If you have a small jaw, if you have crowded teeth, if you have enormously big teeth like mine, then you would need braces. But these primate spaces are there for that particular reason. Okay, so now we all know, I don't think we've gone over this yet, but we will in the future. The occlusion in the permanent teeth is, is class 1, class 2, class 3. Now, in primary dentition, it's called step relationships, and it's going to be straight or flush terminal plane, mesial step, distal step. And I put this little picture just to illustrate what it is and how it looks like. Primary molar relationships are known as step relationships. So for the mesial step relationships, when does it happen? I'm pretty sure it's this one. It's when the distal surface of the mandibular second molar, the distal surface right over here, is mesial to the distal surface of the maxillary second molar. So it's mesial to the distal surface of the maxillary second molar, right? This would result in a permanent normal class 1 occlusion. Sometimes it results in class 2 instead. I mean, if we really go by the books exactly and forget clinically what happens, basically the straight flush terminal plane over here, that results in class 1 typically. Mesial step results in class 2 and distal step results in class 3. But since, there's a lot of clinical cases that are different, just keep in mind that the straight flush terminal plane will result in class 1 for sure, right? the mesial step may result class 1 or class 2, depending, you know, on the primate spaces, depending on the permanent teeth size and shape, and all those factors play a role. The growth of the child, how fast is the child growing, you know. Okay, so distal step relationships is when the distal surface of the mandibular molar is distal to the distal surface of the maxillary second molar, and this results in permanent class 2 occlusion. Okay, so it results in class 2 occlusion. You know, like I said again, you know, there are differences between patient to patient. Some are already born with a class 3 step relationship, or, you know, and they just continue to develop into a class 3. Some, you know, they have perfect occlusion as in a primary dentition, but then when they develop into the permanent dentition, it's different. So just know what the step relationship is, what the relationship of the molars are, and you'll be fine. Okay, and that's it for today. So within the next few weeks, we're going to be talking a lot about the occlusion, the mandibular movement, some occlusion terms, you know, just to refresh your memory, or, you know, if it hasn't occurred to you yet, you know, we'll just go over it. We'll learn new things. We'll learn a lot about the oral biology of the oral cavity, what cells make up what's keratinized, what's non-keratinized, and all that good stuff. Okay. So for now, that's it for today, and I'll see you guys next week.